This sleeping position may increase stroke risk. What to do instead? If you've been waking up with headaches or feeling foggy, your sleeping position might be putting you at risk for something far more serious than a bad night's rest. In the next minutes, I'm going to show you exactly how the way you sleep could be affecting your stroke risk, and more importantly, what you can do about it tonight. As a specialist who's worked with stroke prevention and recovery for over 15 years, I've reviewed hundreds of sleep studies and worked with patients who never knew their pillow placement could matter this much. What I'm about to share isn't theory. It's backed by research from institutions like Johns Hopkins and the American Stroke Association, and it's already helping people sleep safer. Here's what most people don't realize. One common sleeping position actually restricts blood flow to your brain while you sleep. Another position that doctors used to recommend might be making your snoring dangerous. And the case I'm going to share in a few minutes involves a perfectly healthy person who had a stroke simply because of how they turned their head on the pillow. But here's the good news. Simple adjustments you can make tonight could dramatically lower your risk. We have a few minutes together, and by the end, you'll know exactly how to position yourself for the safest, most restorative sleep possible. You'll understand the warning signs your body might already be giving you, and you'll have a clear action plan to discuss with your doctor. But before we dive in, tell me in the comments what city and country you're watching from. Now, let me ask you something. Have you ever wondered why you feel so terrible some mornings, even when you slept a full 8 hours? Or why your doctor keeps talking about your blood pressure, but nobody's mentioned how you're sleeping? That connection is what we're exploring today, and it might be the missing piece you've been looking for. I'm going to walk you through 5 critical things about sleep position and stroke risk. Number 2 involves something happening in your throat right now as you watch this. Number 4 is a position that seems comfortable, but could be compressing a vital artery. And number 5, well, that's the story that made me completely change how I counsel my patients about sleep. Point 1, why sleep matters for stroke risk. Let's start with something that might surprise you. Your brain does some of its most important cleanup work while you sleep. When you understand this connection, you'll realize that improving your sleep isn't just about feeling rested. It's about protecting your brain from one of the most devastating health events possible. Think about the people you love, your grandchildren, your partner, the life you've built. A stroke can change everything in seconds. But here's what gives me hope. So much of stroke risk is within your control, and it starts with something as simple as how you position your body at night. Here's what happens. During deep sleep, your brain flushes out toxins, your blood pressure naturally drops, and your heart gets a break. But poor sleep quality keeps your blood pressure elevated, increases inflammation in your blood vessels, and puts constant stress on your cardiovascular system. Over months and years, this significantly raises your stroke risk. So what does this mean for you tonight? First, recognize that sleep quality matters just as much as sleep quantity. If you're waking up exhausted despite being in bed for 8 hours, something's wrong. Second, start paying attention to how you feel in the morning. Headaches, grogginess, or a racing heart when you wake up are your body's warning signals. Write these down for a week and share them with your doctor. Robert, who's 66, came to me complaining about morning headaches. We changed nothing but his sleeping position and pillow height. 3 weeks later, his headaches were gone and his blood pressure readings improved. Now, morning symptoms are important, but there's something happening during the night itself that's even more critical. Let me explain. Before we continue, let me say something. I created a complete senior's guide to supplements and health products that can change your quality of life. Link in the first comment. Point 2, sleep apnea and sleeping on your back. This next one affects millions of people over 60, and most don't even know they have it. Understanding this could explain years of fatigue, and fixing it could reduce your stroke risk by up to 60% according to recent studies. Have you ever been told you snore loudly? Has your partner mentioned that you stop breathing during the night? This isn't just annoying. It's your body literally struggling for oxygen while you're unconscious. Your brain is paying the price. When you sleep on your back, gravity pulls your tongue and soft tissues backward, partially blocking your airway. This is called obstructive sleep apnea. Every time your breathing stops, your oxygen levels drop and your blood pressure spikes as your body panics trying to breathe. These repeated spikes, night after night, damage your blood vessels and dramatically increase stroke risk. Here's what to do. If you're a back sleeper and you snore, try sleeping on your side instead. Use a body pillow to keep yourself from rolling onto your back. Some people sew a tennis ball into the back of their pajama top as a reminder. It sounds odd, but it works. If you have diagnosed sleep apnea, using your CPAP machine consistently is non-negotiable. It's not just about feeling rested, it's about keeping your brain safely oxygenated all night long. Linda, 62, resisted using her CPAP for months. Once she started, not only did her energy return, but her cardiologist was amazed at how much her blood pressure stabilized. Sleeping on your back can be risky if you have apnea, but here's something that surprises people even more. The total amount of time you spend asleep matters too, and not in the way you think. Quick question before we continue. Right now, count on your fingers how many hours you typically sleep each night. Hold that number in your mind. What I'm about to tell you might change how you think about those hours forever. Point 3. Too little or too much sleep. Most people know that sleeping too little is bad for you. But what if I told you that sleeping too much carries risks too? Getting this balance right could lower your stroke risk by up to 25% compared to people with irregular sleep patterns. I know how it feels to lie awake at 3 in the morning, worried about everything, or to sleep away half the weekend because you're just so exhausted. Both patterns are telling you something important about your health. Large studies tracking thousands of people have found a clear pattern. Sleeping less than 6 hours regularly increases stroke risk. But here's the surprise. Sleeping more than 9 hours consistently also increases risk. Why? Short sleep keeps your blood pressure high and increases inflammation. Long sleep is often a sign of underlying health issues, poor sleep quality, or conditions like depression that also affect stroke risk. Aim for 7 to 8 hours of actual sleep, not just time in bed. Track your sleep for a week using a simple notebook. Write down when you go to bed, when you wake up, and how many times you remember waking during the night. If you're consistently outside that 7 to 8 hour range, or if you're waking frequently, talk to your doctor. There might be treatable causes like medication side effects, sleep apnea, or restless leg syndrome. Michael, 69, was sleeping 11 hours a day and still felt exhausted. Testing revealed severe sleep apnea and early heart failure. Treating both conditions not only improved his energy, but likely prevented a stroke. Sleep duration matters, absolutely. But there's a specific position that can actually compress the arteries feeding your brain. And this one shocked even me when I first learned about it. Point 4. Extreme positions and vascular compression. This sounds rare, and it is, but it's so important that I need you to hear this story. This simple awareness could prevent a type of stroke that happens to otherwise healthy people, often without any warning. Imagine going to bed feeling perfectly fine and waking up with stroke symptoms. No history of high blood pressure, no heart disease, just wrong place, wrong position. It sounds terrifying because it is, but it's also preventable. There's a condition called Bowhunter's stroke. It happens when extreme rotation of your head and neck compresses the vertebral arteries that run through your spine to your brain. Some people sleep on their stomach with their head turned sharply to one side for hours. In certain individuals, especially those with arthritis or bone spurs in their neck, this position can restrict blood flow enough to cause a stroke. If you sleep on your stomach, pay attention to neck pain or morning dizziness. These are warning signs. Consider transitioning to side sleeping instead. Use a thin pillow that keeps your neck relatively straight, not twisted. If you have neck arthritis or have been told you have cervical spine issues, absolutely discuss sleeping positions with your doctor. A simple adjustment could eliminate this risk entirely. A case study from the Journal of Neurology described a 55-year-old who had recurrent mini-strokes, all happening during sleep. The cause? Sleeping face down with extreme neck rotation. Changing position eliminated the problem completely. Now, I've shown you how sleep can increase stroke risk, but here's something equally important. Stroke can also destroy your sleep, creating a vicious cycle. We're more than halfway through, and you've already learned 4 critical connections between sleep and stroke. Stay with me for the next few minutes because what's coming next ties everything together and gives you a complete action plan. Point 5, the two-way connection. This pattern shows up in my practice constantly, and it breaks my heart every time because it's so hard to break. Understanding this cycle means you can intervene early, protecting both your sleep and your brain for years to come. Picture this. Someone has a stroke, even a mild one. They recover, but now they can't sleep well. The poor sleep raises their risk for another stroke. Another stroke makes sleep worse. Round and round it goes, each problem feeding the other. Research shows that people who've had strokes often develop sleep disorders afterward. Damage to brain areas that regulate sleep, anxiety about having another stroke, and physical discomfort all disrupt rest. Meanwhile, the poor sleep increases inflammation, keeps blood pressure high, and raises the risk of a second stroke significantly. It's a cycle that needs to be broken from both sides. If you've had a stroke or TIA, treating sleep problems is just as important as taking your medications. Ask your doctor about sleep studies if you're experiencing poor rest. Practice relaxation techniques before bed. Keep your bedroom cool, dark, and quiet. Some stroke survivors benefit from cognitive behavioral therapy for insomnia, which works better than sleeping pills long-term and doesn't carry risks of falls or memory problems. Janet had a minor stroke at 64. She developed terrible insomnia afterward, terrified it would happen again. Cognitive behavioral therapy and a consistent bedtime routine broke the cycle. 2 years later, she sleeps well, and her stroke risk factors are well controlled. Now that you understand these connections, let me give you the most important practical information. What position should you actually sleep in? Before I answer that, try this with me right now. Lie down on your side as if you're going to sleep. Notice how your head, neck, and spine align. That alignment matters more than you might think, and I'm about to show you exactly why. Point 6. The best sleeping positions. After everything we've discussed, this recommendation might seem simple, but simple doesn't mean easy or unimportant. Getting this right tonight could immediately improve your sleep quality and start reducing your stroke risk from this very evening forward. You deserve to sleep peacefully, knowing you're doing everything you can to protect your brain. You deserve to wake up feeling refreshed, not frightened or foggy. This is entirely achievable, and it starts with position. Side sleeping, particularly on your left side, offers multiple benefits. It reduces sleep apnea by keeping your airway open. It improves circulation. It takes pressure off major blood vessels. Your spine stays in better alignment, reducing neck strain. For people with heart conditions, left side sleeping may reduce the workload on your heart. It's not magic. It's simply physics and anatomy working in your favor. Here's your sleep position strategy. Place a pillow between your knees to keep your spine aligned. Use a pillow that keeps your head level with your spine, not tilted up or down. If you keep rolling onto your back, use a body pillow to wedge yourself in place. It takes about 2 weeks to adjust to a new sleeping position, so be patient with yourself. If side sleeping causes shoulder pain, try hugging a small pillow to take pressure off that shoulder. Thomas, 71, struggled with this change for 10 days. He almost gave up. By week 3, he couldn't imagine sleeping any other way. His snoring decreased dramatically and his wife was thrilled. A good position helps tremendously, but there are warning signs that mean you need more than just a position change. You need medical attention. Point 7. Warning signs to never ignore. Some symptoms seem minor, but are actually your body screaming for help. Let me tell you what to watch for. Catching these signs early and acting on them could literally save your life or prevent devastating disability. You know your body better than anyone else. When something feels wrong, it usually is. Trusting those instincts and seeking help isn't being paranoid or weak. It's being smart and proactive about the life you want to keep living. Certain morning symptoms are red flags. Loud snoring with pauses and breathing suggests sleep apnea, which we know increases stroke risk significantly. Waking with severe headaches, especially if they're new or worsening, could indicate overnight blood pressure spikes or other vascular issues. Waking with numbness, tingling, or weakness on one side of your body is a medical emergency. Even if it goes away, it could be a warning stroke. Morning dizziness or vertigo, especially with neck pain, might indicate circulation problems in the arteries feeding your brain. Here's what to do right now. If you have any of these symptoms, don't wait for your next scheduled appointment. Call your doctor today. If you experience sudden numbness, weakness, confusion, trouble speaking, vision changes, or severe headache, call emergency services immediately. Write down when symptoms happen, how long they last, and what you are doing. This information helps doctors diagnose the problem faster. And please, don't minimize symptoms because you don't want to bother anyone. Your life is worth the phone call. Patricia ignored morning headaches for 3 months, thinking they were just part of aging. When she finally saw her doctor, her blood pressure was dangerously high. She was weeks away from a major stroke. Treatment started immediately, and she's fine now, but those 3 months of delay could have cost her everything. These warning signs matter, but let me pull everything together now, so you know exactly what to do starting tonight. We're almost at the end, and I want to make sure you have a clear action plan. Grab a piece of paper if you can, or just make a mental note. I'm about to give you 3 specific steps you can take in the next 24 hours. Let me bring this all together for you. Your sleeping position can absolutely affect your stroke risk, but it's part of a bigger picture. Sleep apnea, especially when sleeping on your back, creates dangerous oxygen drops and blood pressure spikes night after night. Sleeping too little or too much, both signal problems that need attention. Extreme neck positions can, in rare cases, compress vital arteries, and stroke and sleep problems feed each other in a cycle that needs to be broken. But here's what matters most. You have power over this. Tonight, you can make changes that protect your brain. Step 1. Evaluate your current sleep position. If you sleep on your back and snore, or if you sleep on your stomach with your head sharply turned, commit to trying side sleeping. Get the pillows you need to make it comfortable. Give yourself 2 weeks to adjust. Step 2. Track your sleep for 1 week. Write down your bedtime, wake time, and how you feel each morning. Note any headaches, grogginess, or other symptoms. This information is gold for your doctor and helps you see patterns you might be missing. Step 3. Schedule a conversation with your doctor specifically about sleep and stroke risk. Bring your sleep notes. Ask about sleep apnea testing if you snore. Discuss your blood pressure, especially if you have morning symptoms. Ask if your current medications might be affecting your sleep quality. Here's what I want you to remember. Aging doesn't mean accepting decline. It doesn't mean giving up quality of life. You've spent decades taking care of others, building your life, gaining wisdom. Your brain deserves protection. Your independence deserves fighting for, and something as simple as how you position yourself at night can be part of that fight. Sleep is when your brain heals, consolidates memories, and clears out toxins. It's when your cardiovascular system gets the rest it desperately needs. Respecting your sleep isn't self-indulgent. It's essential healthcare. You don't have to do everything perfectly. You don't have to change your entire life overnight. But you can adjust your pillow tonight. You can pay attention to warning signs. You can have one conversation with your doctor. These small steps compound over time into significant protection. Now I want to hear from you. Which of these changes will you make first? Are you going to try side sleeping tonight? Will you track your sleep this week? Tell me in the comments. I read every single one, and I often reply personally because your questions help me create better content for everyone. And if someone you love might benefit from this information, please share this video with them. Stroke prevention isn't just about one person. It's about families, communities, and looking out for each other. If this information helped you understand your health better, consider subscribing. I create content specifically for people over 60 who want honest, science-based guidance without the fear-mongering or false promises. Just real information that helps you make better decisions about your health. You came here because the title caught your attention, maybe made you a little worried. I hope you're leaving with something different. Not fear, but knowledge. Not worry, but a plan. Sleep well tonight, my friend. Your brain is counting on it. One last thing. Everything I've shared today is educational information to discuss with your healthcare provider. Not medical advice for your specific situation. Your doctor knows your complete health history and can give you personalized guidance. Always consult with them before making significant changes to your sleep habits or if you have concerning symptoms. Thank you for spending these minutes with me. Take good care of yourself. Remember, if you want, I will make available our complete guide for seniors on supplements and health products that can change your quality of life. Link in the first comment with a limited time offer.